you to our major sponsors. Conjugate Corporation. Thank you to our major sponsors. Conjugate Corporation. Distrofil, Distribution Solutions Philippines Incorporated. Johnson's & Johnson's Philippines. Lundbeck Philippines. MedChoice, CNS Pharma Group. Medicam, the CNS subsidiary of Unilab. Otsuka Pharmaceuticals. Torrent Pharma Philippines. We would also like to thank our minor sponsors. Abbott Laboratories, Sun Pharma Philippines, Zydus Neurosciences. Special thanks to Vexa Life Sciences. This event is powered by Beatrice. Thank you to our major sponsors. Conjugate Corporation. Distrofil, Distribution Solutions Philippines Incorporated. Johnson's & Johnson's Philippines. Lundbeck Philippines. MedChoice, CNS Pharma Group. Medicam, the CNS subsidiary of Unilab. Otsuka Pharmaceuticals. Torrent Pharma Philippines. We would also like to thank our minor sponsors. Abbott Laboratories, Sun Pharma Philippines, Zydus Neurosciences. Special thanks to Vexa Life Sciences. This event is powered by Beatrice. Thank you to our major sponsors. Conjugate Corporation. Distrofil, Distribution Solutions Philippines Incorporated. Johnson's & Johnson's Philippines. Lundbeck Philippines. MedChoice, CNS Pharma Group. Medicam, the CNS subsidiary of Unilab. Otsuka Pharmaceuticals. Torrent Pharma Philippines. We would also like to thank our minor sponsors: Abbott Laboratories, Sun Pharma Philippines, Zydus Neurosciences. Special thanks to Vexa Life Sciences. This event is powered by Beatrice. Thank you to our major sponsors: Conjugate Corporation, Distrofil, Distribution Solutions Philippines Incorporated, Johnson's & Johnson's Philippines, Lundbeck Philippines, MedChoice, CNS Pharma Group, Medicam, the CNS subsidiary of Unilab. Otsuka Pharmaceuticals. Torrent Pharma Philippines. We would also like to thank our minor sponsors: Abbott Laboratories, Sun Pharma Philippines, Zydus Neurosciences. Special thanks to Vexa Life Sciences. This event is powered by Beatrice. Thank you to our major sponsors: Conjugate Corporation, Distrofil, Distribution Solutions Philippines Incorporated, Johnson's & Johnson's Philippines, Lundbeck Philippines, MedChoice, CNS Pharma Group, Medicam, the CNS subsidiary of Unilab. Otsuka Pharmaceuticals. Torrent Pharma Philippines. We would also like to thank our minor sponsors: Abbott Laboratories, Sun Pharma Philippines, Zydus Neurosciences. Special thanks to Vexa Life Sciences. This event is powered by Beatrice.
Good morning, everyone. Welcome to the Makati Medical Center section of Psychiatry's 20th postgraduate course and third webinar series entitled Bridging Mental Health The Pursuit of Well-Being. I am Dr. John Lay Arboleda, current Chief Resident of Section of Psychiatry, and I will be the moderating today's session. For the webinar series, we aim to promote the importance of mental health through a series of lectures focused on mind-body connections and its significance to our overall well-being. Today, our speakers will focus on discussing sleep. We are excited to be having this webinar series with the help of our pharmaceutical sponsors and all those who made this possible. We would like to thank our major sponsors for today: Conjugate Corporation, Distribution Solutions Philippines Incorporated, and Johnson & Johnson's Philippines. We would also like to thank Multicare for graciously providing us our accommodations for this postgraduate course. Before we officially start, we would like to remind the audience of our house rules. To officially open today's webinar, let us welcome our Chief of Section, Dr. John Edward B. Horilla, for the opening remarks.
Good morning, everyone. On behalf of the Makati Medical Center Section of Psychiatry, I would like to warmly welcome you to our 20th postgraduate course and third webinar series on mental health entitled Bridging Mental Health, the Pursuit of Well-Being. Now, more than ever, people are realizing the importance of mental health as it contributes to our overall well-being. With this in mind, for this year's lecture series, we have invited speakers from different fields of medicine to partner with our mental health experts in discussing the mind-body connection. Today, we will be focusing on sleep and its role in both our physical and mental health through the lectures of neurologist Dr. Picar and our very own sleep specialist and psychiatrist Dr. Roque. As we continue to get used to and be comfortable in the new normal, join us as we learn how vital rest is in developing a healthy mind and body. We would like to thank today's sponsors, Conjugate, Distrifill, and Johnson & Johnson for generously supporting today's event. Thank you as well to everyone for joining us, and we hope you continue to do so every day until Friday. Keep safe and enjoy the lectures today.
Our first speaker for today is a neurologist and a sleep specialist, Dr. Rosalina Espiritu Picar. She practices in Makati Medical Center. She graduated cum laude with a Bachelor of Science in Biology from University of Santo Tomas. She then proceeded to study medicine in the same institution where she also graduated cum laude. She took up her residency training in neurology in Makati Medical Center and served as a chief resident during her senior year. She then took up fellowship program in sleep medicine in Columbia Presbyterian Medical Center in Newark, USA. Dr. Espiritu Picar also served as the president of Philippine Neurological Association for the year 2020, and currently she is the co-director of the Sleep Disorders Laboratory of Makati Medical Center, the section chief of neurophysiology in the University of Perpetual Health Medical Center in Binyan, Laguna, and the section chief and an associate professor in clinical neurology in Dr. Jose G. Tamayo Medical University, also in Binyan, Laguna. She currently holds active practice in Makati Medical Center, University of Perpetual Health Medical Center, Binyan, Laguna, Mount Sinai Medical Center, Santa Rosa, Laguna, Santa Rosa Medical Center in Santa Rosa, Laguna, and Medical City, Southern Luzon, Santa Rosa, Laguna. Let us all welcome Dr. Rosalina Espiritu Picar.
Thank you, Lay. Thank you and good morning. And I would like to thank the section of psychiatry for the kind invitation to talk to you today about the basics and promise of sleep. I hope you can see my slides. Lay, kita ba? Are you okay with the slides? Okay, I will presume that you are.
Yes,
okay.
Doctor.
All right. So let's get to the to the meat of the matter. So I am to talk about the basics and the promise of sleep in terms of what sleep is, what it does, how it happens, and how important it is for our daily lives. So let us begin. So we need to understand that sleep is an important part of health. And I would like to start with this definition of what sleep health is. And it is a multidimensional pattern of sleep wakefulness. It is adapted to your individual, social, and environmental demands that promotes physical and mental well-being. So that means that we need to pay attention to sleep, and so that we can maximize its use in terms of maintaining health and preventing disease. And when we talk about good sleep health, it's not enough to just talk about the duration of it. We also need to talk about the efficiency by which it occurs, and whether the sleep is enough duration and of at the right timing that it can actually sustain alertness, and there is actually satisfaction in terms of our sleep. Okay. So if we look at the definition further, we need to understand that sleep actually has several dimensions, and that means timing, efficiency, and duration. And that if we maintain these dimensions at its optimum level, then we can actually guarantee satisfaction as well as guarantee alertness during the day. This sleep dimensions has a bidirectional relationship in terms of affecting genetic, epigenetic, molecular, and cellular processes, and eventually go up to system level processes. And at the rest of the lecture, you will understand some of the importance of that in terms of the cellular and the system level effects of sleep, and how these diseases also, in a reverse manner, also affects the quality of our sleep. Eventually, if we are able to harness the promise by which sleep occurs, we can actually maximize health, prevent disease, and also optimize our function. So we need to understand that sleep is a basic physiologic drive. We spend a third of our lives in sleep, and therefore it is an important part. It plays an important role in terms of how we function and how we optimize our functioning. So in addition to procreation, drinking, breathing, and eating, sleep is also a basic physiologic drive. Now, how does sleep occur? So let us not get overwhelmed by the pictures. It is as important to understand that sleep and wakefulness occur in what is now more commonly accepted as a flip-flop switch. And that means that there are certain areas of the brain that are actually activated when we are trying to stay awake. And that is mostly the monoaminergic systems that originate from the brainstem areas, which eventually project to the cortex. So it's actually a bottom-up scenario. And there is also another neurotransmitter system that is actually important, and that is the orexinergic system. And that the orexinergic system maintains, the continuous stimulation of these monoaminergic areas, and therefore sustains wakefulness. So it's an important transmitter system in that it actually plays a role in terms of maintaining wakefulness. In the opposite, what we need is to turn off those monoaminergic pathways, and that is through the role of orexin to promote sleep. And the other thing is that the other transmitter systems that is important for maintaining sleep, which is mostly the GABAergic pathways, also get their input from the suprachiasmatic nucleus and also from the hypothalamus. By the activation of this GABAergic transmitter systems, what happens is that it turns off the monoaminergic systems, and therefore patients go into sleep. So it's actually like a seesaw, and depending on which chemical system actually is predominant, which actually explains the occurrence of wakefulness and sleep. Just to reiterate that wakefulness is mostly a monoaminergic system problem, and therefore there is a projection from the brainstem areas, mostly monoaminergics, and the orexinergic system also puts a role in terms of maintaining stimulation of these aminergic systems, and therefore these systems project to the cortex, and therefore you have consciousness or wakefulness. And the opposite is true in that the hypothalamus is typified by the GABAergic stimulus coming from the preoptic areas in the hypothalamus, stimulates, or shall we say, inhibits these monoaminergic systems and therefore turns them off, and we therefore result in sleep. So why is sleep? What does sleep? Uh, what is why is sleep important? So as Alan Ratschaffen actually mentioned, and Alan Ratschaffen is very important because he actually is one of the people who initially described the different stages of sleep. And that he mentioned that if sleep does not serve an absolutely vital function, it's actually the biggest mistake the evolutionary process ever made. It is a requirement that people sleep, and it must therefore serve a very important function. Just to review in terms of what when sleep happens at night. So if you're able to spread out your sleep period during the evening, so from 10 p.m. to around 6 a.m. in the morning, you get around 3 to 5 REM cycles. And therefore, you go through from wakefulness, which is marked by a brain activity that is mostly in the alpha range. And then you go into drowsiness, which is light sleep, mostly characterized by theta activity. Then you go into legitimate sleep, which is stage 2, which is characterized by archaic complexes and sleep spindles. And then gradually go into deeper sleep, which is characterized by delta activity. So you can see that brain activity, or the brain activity that is recorded in the sleep study, actually helps us to differentiate in terms of the different sleep stages. Now, after the patient or the subject goes into deep sleep, they usually go into the first REM cycle. And as you can see from this hypnogram, is that the deep sleep tends to occur in the first half of the evening, while REM sleep tends to predominate in the latter half of the evening. And therefore, when you are sleep deprived, that means that if you only sleep for 3 hours instead of the usual 8 hours, then you're actually selectively depriving yourself of REM sleep. The other thing is that deep sleep is also characterized by several hormonal important functions. And that means that the growth hormones usually secreted during deep sleep. And that is why children tend to spend a bigger amount of time in deep sleep, because they need it for growth hormones to occur and for growth to occur. As you get older, you spend less time in deep sleep. All right. So deep sleep tends to become less as you get older because you don't need the growth hormones as much. And so what differentiates, or what actually controls whether we're awake or asleep, is aside from the occurrence of the awake period, that means the amount of wakefulness, the adenosine load, as well as the effect of melatonin, as well as the circadian output. Also, wakefulness is also defined, or shall we say, dictated by also your amount of caffeine, the alcohol that you use, and also the amount of exercise. So the brain systems which we discussed earlier are also affected by not just endogenous processes such as your circadian rhythm and your adenosine load, but also by your environmental and individual activities and such. So when we talk about sleep regulation, there are actually two main processes which control whether we fall asleep or not. And one is circadian alerting, and that means the time of day or the time of night. And therefore, usually, we go around a 24-hour circadian rhythm. And what you will notice is that, of course, there is a certain amount or a certain time in the night that actually gives you the highest propensity for sleeping. And that usually occurs between 9 to 12 in the evening for those in the regular sleep phase. And it is also characterized by a melatonin surge, and also which also characterizes sleep to occur. Now, as you go on during the day, for example, sleep homeostasis is the amount of sleep load that tends to accumulate as you go through the day. So from being fully alert and being without any amount of sleep load, as you go through the day, the sleep load steadily increases, thereby increasing your propensity for sleep. So if we look at them in an overlapping manner, so the sleep drive progressively increases as you go through the day. And of course, your alertness following the circadian rhythm gradually decreases as the day wanes. No? And eventually the sleep drive will be so high, that means the sleep need is so high, and that also corresponds to your adenosine load, that eventually this will time with the circadian rhythm of falling asleep, the melatonin surge, and therefore the subject falls asleep. And so you can see that to have healthy sleep, you actually need to have a synchronization of both of these processes. And if you're able to do that, then you're actually going to be able to sleep fairly well. Now we talk about the several sleep dimensions that we mentioned in terms of sleep health. Allow me to talk a little bit in greater detail of some of these dimensions because they will all impact sleep health. So first of all is timing, and we need to discuss circadian rhythms for that. So circadian rhythms are a biological rhythm which occurs in approximately 24 hours. So circa, around, dia, meaning around the day, which is around 24 hours. So most human functions actually occur in a circadian rhythm. So it occurs within 24 hours. And so what happens is that if you look at this picture, and if we discuss them little by little, so you can see that the circadian rhythm is um, coordinated, or shall we say, conducted through the use of a central clock, which is the suprachiasmatic nucleus in the hypothalamus. Now, the stimulus that sets the circadian clock is mostly the day and night schedule. So that means the amount or the absence of light, your feeding behavior, as well as your other social behaviors, the amount of physical activity, as well as your core body temperature. All of these zit givers or phase setters actually talk to your central clock, and therefore gives it an idea that it is time to be sleeping, it is time to be waking up. Within the suprachiasmatic nucleus inside the hypothalamus, it also shows a specific cellular clock, and therefore it also follows a 24-hour rhythm. Now, more importantly, is that the central clock is also synchronized with the peripheral clocks. And that means that there are also cellular clocks in all of the different systems or processes of your body. The cardiovascular system, the gastrointestinal system, the nephral system, the central nervous system, and even the immunological system. So they all follow a circadian rhythm, and they're all coordinated with a central clock. I hope you understand the importance of this, and that is why it also explains why, for example, the blood pressure tends to be highest in the morning, in time with a cortisol surge that characterizes the early morning hours when you wake up. And also there is a dip in the blood pressure in the evening. Also, when you're falling asleep, the pulse rate goes down, the blood pressure also goes down. In the gastrointestinal system, for example, gastric motility slows down when you're falling asleep, and also cholesterol synthesis and also other hormonal systems that are mediated by the gastrointestinal system also follows a circadian rhythm. The immune system also follows a circadian rhythm, which we will see later on. Urine production slows down when you're falling asleep, so it follows a circadian rhythm. And all of these rhythms are actually coordinated by the suprachiasmatic nucleus, and which is also, in a way, regulated or controlled by the phase setters. So what we want is really to be in line with our own central and peripheral clocks, and in line with the day and night cycle, as well as with our regular physical and social, individual and social activities. Okay. So what are the effects of the synchronization? So if you do not follow the circadian rhythm, which is inborn, or shall we say innate in your system, what will occur? So just like an orchestra that is not well coordinated. So as you can see from the picture, the first violinist is asleep. And what happens is that the rest of the orchestra are doing the things that they want to do. They've all gone rogue. And so what will happen? What will happen is that, of course, the music that you will get will not really be good. And in the physical sense, in the medical sense, this will actually lead you to disease. So when there is chrono disruption, such as if you have circadian misalignment, such as shift work, or if you have jet lag or social jet lag, or if your chronotype is more towards a delayed sleep phase, or if you really have a clock gene mutation wherein there's a disturbance in clock function inside the brain, for example, this will all affect physiological mechanisms which of course follow the circadian rhythm as well. So the cardiovascular system is affected, immune system is affected by causing a pro-inflammatory state, which of course will eventually lead to disease. So in addition to chrono disruption, you also have the mitigating factors such as independent or such an unhealthy diet, lifestyle, which of course will further impact the problem that is already posed by chrono disruption. So one very specific and very easy example is sleep timing and caloric intake. So they did Dr. Phyllis Z actually conducted an experiment in terms of she just simply compared the total amount of caloric intake between people who are late sleepers and those who are sleeping in the regular sleeping periods. And what they found is that late sleepers, especially in the later evenings, where they tend to be more awake, tend to have a higher caloric intake than those who were on the average. So those who were sleeping at the average time, the usual time, tend to have a plateau, no? So they tend to, well, most of the time because they're asleep during this time, while those who are late sleepers tend to have increase in caloric intake. And you might ask yourself, why does that happen? Is it because they're awake? Well, not necessarily. What we need to understand is the concept of what we call the brain pool. So when you're actually falling asleep, the main purpose of sleeping is for energy conservation. It's the time by which all of the systems slow down. So they go into an idling state, an idling state. And therefore, you need less energy for that state to be maintained. Now, the brain is the paramount metabolic player. So the brain is a fairly small organ, but it requires a huge amount of energy to continue to occur. We need to understand that sleep is not an inactive process. No, sleep is an active process specifically for brain function. There are a lot of things that are happening in your brain, even though you're asleep. So what happens is that when you're forcing your body to be awake when it's supposed to be asleep, there is a pulling of the energy from the rest of the body towards the brain, because the brain is very important. Uunahin ng katawan yon, no? And so what happens is that in sleep disruption, there's increased neuroenergetic demands by the brain, causing a pulling of energy for the brain at the expense of the body. So what happens is that there is a hunger hormone imbalance, and also there is a hypometabolism in the prefrontal cortex, resulting in poor decision making. So what happens? What happens is that there is a neurohormonal imbalance in terms of our leptin and ghrelin levels. Now, leptin levels, just to remember, is the satiety hormone, and ghrelin is the hunger hormone. And so when you have reduced leptin levels and you have an increase in ghrelin levels, you eventually develop an enhanced appetite for calorie-rich food and increasing the total caloric intake. So by having those late nights or staying awake far longer than what your circadian rhythm requires, ends up with you choosing foods that are not necessarily healthy for you. That means that you tend to go for the sweets, you tend to go for those that are higher in fat content, and therefore resulting in the devastating cardiovascular metabolic circumstances or disturbances. And that is why people who have lifestyle that is actually not really in time with the regular circadian rhythm, such as shift workers or those who have a delayed sleep phase, have a higher risk for the development of diabetes, metabolic syndrome, and also have disturbed social-temporal patterns. So it's not just that you eat more and that you eat unhealthily. It also affects behavior. You tend to have more desire for hedonistic behavior. You want satisfaction and you want it now. And therefore, it increases your risk for behavior that is not necessarily healthy, such as sexual promiscuity, smoking, and alcohol abuse. So When there is disruption, it actually increases your risk for cardiovascular and cerebrovascular disease. And you can see that in the resulting increase in wake time blood pressure, because yun na yung time na magre-rest siya. So sometimes you will have the loss of the normal dipping that occurs during sleep. And also you have an increase in the serum level of inflammatory markers. Therefore, you have an increase in terms of a pro-inflammatory state, which will of course accelerate atherosclerosis. So just to recap, that if you do not follow the circadian rhythms that is mandated by your body in terms of the peripheral circadian clocks, this results in abnormalities in terms of cardiovascular health, immune health, glucose homeostasis, as well as hormonal regulation. Now, how about the brain? No? So the brain is also an important player, and that if you do not follow the circadian rhythm, this actually causes dysregulation and also accelerates degeneration. So we can see that aside from the suprachiasmatic nucleus being the main player or conductor of circadian rhythm of all the whole body, circadian clock genes are actually expressed in most brain cells, no, including your neurons, your astrocytes, and microglia. So they also follow a rhythm, okay? And each of which exhibits circadian clock gene oscillations, even in culture. So even outside of it, they actually still follow a certain rhythm. And so what they are postulating is that if you have circadian misalignment in these cases, then what happens is that it increases the propensity for disease. So redox homeostasis inside the brain is closely linked to circadian clock function, because your astrocytes and your glia is actually very important in terms of maintaining homeostasis inside the brain. Also, you have an increase in inflammation, and astrocytes and microglia lead to neuroinflammation. Also, aggregation and the clearing of proteins such as amyloid, beta, tau, and alpha-synuclein, which all characterize the more common neurodegenerative diseases such as Alzheimer's and Parkinson's disease, they also follow a circadian rhythm. So what we now understand is that if there is sleep disruption or circadian dysfunction, what will happen is that there is an increase in oxidative stress, an increase in neuroinflammation, therefore resulting in neuronal and synaptic damage, resulting in an acceleration of neurodegeneration. The other thing that is important is that sleep disruption, which might be secondary to circadian dysfunction, or other sleep disorders such as obstructive sleep apnea or restless leg syndrome or insomnia, can therefore increase your sympathetic tone, reduce your slow wave sleep, and impact glymphatic flow. Now, what is glymphatic flow? Glymphatic flow occurs only in slow wave sleep. Okay, it is virtually or literally your brain's trash truck system, no, garbage truck collection system. So what happens in the lymphatic flow is that cerebrospinal fluid, as it goes through the brain and eventually goes to the interstitial fluid, it joins the interstitial fluid by going through the astrocytic vascular end feet. It actually clears away, these proteins that are accumulating in the brain as a function of brain, as a function of neuronal function. So when neurons work, they actually also have waste products that accumulate inside the brain. And so what happens is that this lymphatic flow only occurs when you're in deep sleep. So if your sleep is actually misaligned or disrupted, what happens is that lymphatic flow is also disrupted. And therefore, your garbage isn't collected effectively, and therefore garbage accumulates in the brain. As they have seen in Alzheimer's disease, the deposition, the formation of A beta is actually connected to your circadian rhythm. So A beta accumulates when you have sustained wakefulness, and it is actually decreased during sleep because of the glymphatic flow. So chronic sleep deprivation accelerates beta deposition into the amyloid plaques that characterize Alzheimer's disease. And that's why they're postulating that there is a bidirectional relationship in that if you have poor quality of sleep, you therefore have less slow wave sleep, you therefore increase neuronal activity, you increase deposition, you decrease lymphatic flow, and therefore resulting in amyloid deposition and resulting in Alzheimer's disease. In the same way, if you have neurodegeneration in the form of Alzheimer's disease, this also results in poorer sleep. So it becomes a vicious cycle, no? And we need to emphasize that aside from uh, lack of sleep, there are also other conditions such as sleep disordered breathing, such as sleep apnea, which will also impact the quality of sleep. So that is for timing. We now talk about duration and consolidation. So how much sleep do we really need? So based on the different guidelines in terms of adults and children, this is actually the sleep requirement depending on your age. Please take a picture and remember this in your mind. No? So what you can see here is that the younger the organism, the bigger the necessity or the requirement for sleep, because the body is still developing, the body is still forming, and therefore you can see that when you're asleep, well, aside from growth hormone secretion, that is when cells are actually formed and maintained. No? So growth really occurs during sleeping. And of course, as you get older, because hindi na kayo lumalaki, then the requirement for sleep also progressively decreases. So let us emphasize this, that if you have children, if you have young children, if you have adolescents, 13 to 18 years, they need to be sleeping for an average of around 8 to 10 hours. Do not consider them as small adults. That means do not force the requirement for sleep in adults among children because they need it more. So you need to require that they sleep for a longer period of time. And we will discuss later on why that is very important. So unfortunately, in the study of the American or the National Sleep Foundation, even though the requirement for sleep as marked by the blue lines is higher for all age groups, what we're actually getting across the lifespan is definitely less than what is recommended. And therefore, we will, of course, bear the burden or the consequences of our choices. So we just need to emphasize that disturbed or insufficient sleep eventually results in not just hormonal abnormalities, but also in cardiovascular abnormalities as well, thereby increasing or facilitating disease. Now, what is the effect of sleep lack in children? As I mentioned before, first of all, because of the concept of the brain pool, because of the increase in hedonistic drive, insufficient sleep increases their risk for accidents, injuries, hypertension, obesity, diabetes, and depression. Because they end up they make poorer choices in terms of their food intake. They aim to make up for the lack of sleep or the lack of energy by choosing high energy foods. And it also impacts their state of mental health. So sleep duration and obesity definitely has a very clear association. And that's why they're saying that given the pandemic, there's actually a pandemic of obesity around the world nowadays, it might be actually linked to the amount of sleep deprivation that the world currently experiences. And so it is very important that we emphasize this amongst our children, because the risk for obesity seems to be greatest with those in the pediatric and young adult group. Now let's talk about sleep and the immune system. So nocturnal sleep actually primes the immune system to infectious challenge. That means it prepares it for infectious challenge. So if the patient is not sleeping, what will happen is that there is an increase in inflammatory cells. So you can see that your disease or infection fighting parts of the immune system is actually produced maximally in the evening and declines in the early morning hours. Kaya nga it's primed, it's primed for infection, to fight an infectious challenge. What happens is that when we do not sleep enough, then we have a decrease in the production of this disease fighting parts of the immune system, and an increase in the inflammatory markers. So if you have an increase in sympathetic tone, which is what is usually seen in people who do not sleep well, then of course, and also an increase in inflammatory cascade, then that is actually the perfect combination of things that will accelerate atherosclerosis. What they're also saying is that if you are going to get an injection or vaccination, make sure that you sleep, before you sleep well, before that event occurs. Because what they found is that those who slept very poorly have twice the reduction on the antibody titers in response to vaccination. That means they're not able to put up a good response to the vaccination. How about sleep and cognition or thinking? So the first victim for lacking sleep is really alertness and vigilance. That means if you pull an all-nighter, so if you have a bad duty wherein you can't sleep, you weren't able to sleep at all, what you'll notice is really alertness suffers and vigilance suffers as well. And that's why what you can see is that there is a progressive worsening of performance with sustained focus on cognitive task. And you can see that here. The more you stay awake, the sleep need progressively or geometrically increases. That's the homeostatic process. The circadian process is not really severely affected, but the sleep need progressively, geometrically increases the longer you stay awake. And what they found is that in terms of performance lapses, it also follows that same direction. So it means the longer you stay awake, the performance lapses, especially those requiring alertness, will definitely suffer. To the point that if you consider it, after 10 hours of continuous wakefulness, each additional hour is equivalent to increasing by 0.004% of blood alcohol concentration. That means that if you do not sleep at all for 24 hours, it's equivalent to 0.10% alcohol levels, which is already considered definitely like you are intoxicated. Okay. So it is very ironic that we have laws, or we're very strict about drunk driving and such. And yet we don't really pay attention to those people who are walking around, driving around with less than optimal number of hours of sleep. And yet the effect on the brain is equivalent to being on alcohol. So we also need to remember that sleep is the price we pay for brain plasticity and the ability to learn. So first, sleep is important before learning, because before you can encode a memory, before you can learn something, attention has to be present. So if you're not sleeping enough or not sleeping well, then attention definitely suffers. And therefore, if you're not attending to something, you will not learn it. If you're not attending to something, you will not remember it. Now, the other thing is that aside from achieving or acquiring that information, sleep is also important in terms of consolidating the memory or the thing that you have learned. Therefore, newly learned information, therefore, is transmitted to longer levels of storage of information, and that mostly occurs during sleep, or shall we say, memory consolidation. And that's why if you don't sleep well, then you won't learn as much and you won't remember as much. Now, in the same way that sleep is important for remembering, sleep is also important for forgetting. What do we mean by forgetting? Sleep is important for forgetting the negative connotations of negative memories. So what we found in this experiment, what was emphasized in this experiment, is that if you are sleep deprived, what will happen is that you tend to lose your positive and neutral memories the most, and you tend to keep your negative memories longer. Okay. The other thing that they have found more recently is that dreaming is very important in terms of removing the negative connotation of dreams. And that is why when you're able to sleep and you're able to dream, then that actually results in neutralizing the memory. So although it was emotionally laden before, what happens is that it neutralizes it. It removes the negative connotation of that memory. And so that's why it's important to remember that sleep is important for remembering, but also for forgetting the things that we would much rather forget. So let me take a few moments in terms of discussing the brain systems that are more affected by sleep disruption or sleep deprivation. And I wanted to make this as simple as possible for our non-neurological audience. So we can actually say that the brain has two main functions. So it's a logical brain, which is mostly the frontal cortex, which controls purposeful behavior. It is required for analytical and functions as well as problem solving. So it's for executive function. So it requires full attention and alertness to function at its best. Therefore, when you are well rested and you're awake, then your brain goes into pure logical brain. Okay, so frontal cortex is more predominates. No? So it is actually most impacted by sleep deprivation or sleep disruption, in that way that your frontal cortex tends to be turned off during these periods of sleep deprivation. The emotional brain, or the amygdala and limbic system, is also called the default mode network. So it is the, kumbaga, the primitive part of the central nervous system. So it controls mostly the most basic emotional and primal behavior. So it is required for emotional processing and the management of basic desires and needs. So your drive for food, for it controls your impulse behavior, no, is mostly mediated by the emotional brain or the amygdala and limbic system. It is also called the default mode network. Okay. And when you're sleep deprived or your sleep is disrupted, it actually makes the emotional brain more predominant. Okay. And what does that mean exactly? So the emotional and logical brain are actually, in a way, like in a seesaw as well. And it actually is mediated by the amount of sleep you get. Therefore, if you are not having enough sleep, then what happens is that your logical brain takes the back seat to the emotional brain. Okay. When you are sleep rested or when your sleep is complete, then what happens is that your logical brain takes over and takes the front seat, and the emotional brain takes the back seat. And what is the impact anyway? So what we found is that, especially in terms of those activities that require attention as well as working memory, you definitely need your logical brain for these functions. And what we can see is that in a sleep-rested, stable state, definitely when you're on task, if you have something that you need to do, when you're making a decision in terms of taking care of your patient, definitely you need your logical brain to do that. When you're off task, then it reverts back to its default mode network. Now, what you can see is that if you are sleep deprived, there is a resulting inconsistency in attention and working memory task performance, as shown by the study we mentioned earlier. Now, how about incentive processing? As we mentioned, if you're sleep deprived, the emotional brain predominates. And of course, with the emotional brain, you need to talk about dopaminergic reward systems. And what we found is that definitely the dopaminergic system or the dopamine receptors are affected, resulting in non-optimal incentive-based decision making. That means that you tend to become impulsive in your decisions and you tend to become not logical in terms of making decisions. So what we found is that those patients who are sleep deprived tend to approach risk more. So that means they tend to be unable to gauge, the risks and benefits with regards to a certain decision, and they tend to approach rewards more. And that's why what you can see, in a casino, no ba? Ayaw nila na natutulog kayo dyan eh. No? So if you're in a casino, there's light all the time. So you're engaged. And what happens is that if you're sleep deprived, you tend to have poorer wages. That means you wager poorly, you make poor decisions. And that's why you also tend to shop more. You tend to do things that are actually impulsive. So as we mentioned before, sleep deprivation and impulsivity go together because the emotional brain becomes more the predominant system that takes care of it. No? So when you have deprivation, what happens is that there is a decrease in the communication between the emotional and rational brain, resulting in an impaired ability to accurately discriminate between degrees of emotional salience. So what happens is that there is an over emotional sensitivity and even lack of empathy when you're sleep deprived. So that means that you can see that in your children. Pag kulang sa tulog yan, Diyos ko, masalig mo lang, masungit na kaagad, no? And sometimes they have a hard time in terms of gauging the emotional features of the persons that they are dealing with. In this very nice experiment, what they showed is that sleep rested mimickers, in terms of looking at the demonstration of specific emotional cues, is that those who are sleep rested are definitely more accurate. No? While those who are sleep deprived tends to have inaccurate emotional face mimicry. And that means that their interpretation of what they see can also be affected when they are sleep deprived. So emotional processing is actually also an important part of sleep function. And therefore, when you are sleep deprived or sleep is disrupted, it reduces your coping capacities and your emotional intelligence skills. Sabi ko nga, because you tend to become more impulsive, you tend to not be able to gauge risks and benefits, you tend to go towards reward more and unable to delay gratification, and therefore become more prone towards hedonistic thinking. There's also a tendency for negative emotional perception. In children, especially in adults, in young adults, this becomes an impairment in terms of the capacity to effectively integrate emotional cues in their decision-making process, resulting in poorer impulse control and riskier behavior. No? And we can also see this in children. If you have had the joy of bringing up small children, you remember this. No? Pag kulang sa tulog yan, ang sungit yan. No? And they become more hyperactive, and they become inattentive, and they end up with conduct problems. So you need to also look at the amount of sleep that your children are getting. So the consequences of skipping sleep can be dire, especially for adolescents, is that they have a higher risk for substance abuse, suicidal thoughts, and suicidal attempts. I'm sure Rose will talk about this in greater detail later on. So aside from the volitional choice of not sleeping enough, we also need to remember that sleep disruption and sleep deprivation occurs, especially if you have other sleep disorders, such as insomnia, sleep disordered breathing, such as sleep apnea, if you have parasomnias, if you are a shift worker or suffering from circadian misalignment, or if you have a primary hypersomnolence disorder, such as narcolepsy. Contrary to popular belief, di tulog na tulog, di okay. Not necessarily. Narcoleptics actually sleep a lot, but their sleep is very poor. And it's actually very disrupted. And that is why this sleep disorder should also be looked for when you're dealing with your patients, because they will also impact their general health. So again, to go back to the main slide, to the first slide, in that when we're talking about and advocating for sleep health, we only not focus on one dimension. We focus on all of them. That means timing, duration, and efficiency, because that's the only way that we can guarantee alertness and satisfaction and also maximize health. So the key take-home point is that sleep is a basic integral part of human existence. We should not, take it lightly or ignore it. It serves a multitude of roles that are inextricably linked with basic human physiologic processes that ensure not only survival, but optimizes our physical, mental, and physiological functioning. Sleep offers a valuable, modifiable, endogenous resource that we can actually tap, maximize, and explore towards understanding of human disease and its prevention. Thank you very much for your kind attention, and I'll be happy to answer any questions after Rose's lecture.
Thank you very much po, Dr. Picar, for that very insightful lecture. And I must say, I'm a fan kasi talaga of promoting sleep. Everyone has the need for it, and giving us a basic understanding of the physiology of of how it gives us the proper rest, and how it is affecting our lives in such a significant way, is very important for us. And I think it is very relatable for everyone who is part of our lecture today. And if you have any questions for Dr. Picard regarding her lecture, please use the Q&A box to type in your queries, and our speakers will be addressing them later during our open forum. So before we proceed with the next lecture, we would like to thank our major sponsors for today: Conjugate Corporation, Distribution Solutions Philippines Incorporated, and Johnson& Johnson's Philippines. We would also like to thank Multicare for graciously providing our accommodation for this postgraduate course. For our next speaker, one of the psychiatrists in our section, Dr. Rose Ann C. Roque. Dr. Roque graduated with the Bachelor of Science in Biology from University of the Philippines, Manila. She then proceeded to study medicine in University of Santo Tomas, and her residency training in psychiatry of Makati Medical Center, and served as chief resident during her senior year in residency. She took up her fellowship training in sleep medicine from the Lung Center of the Philippines. And currently, Dr. Roque is an active psychiatry consultant in Makati Medical Center, Medical City, Lung Center of the Philippines, and Cardinal Santos Medical Center. Let us all welcome Dr. Rose Ann C. Roque.
Good day, everyone. Thank you for joining our postgraduate course. I'm Dr. Roseanne Roque. I will be discussing a highly relevant topic, which is sleeping well and mental health. The title is Bedtime Story, but I do hope that you would all still be wide awake by the end of the talk. We have learned a lot about sleep in the previous lecture, and we have to thank Dr. Picar for that. So now I am tasked to discuss its connection to mental health in the pursuit of well-being. These two topics gained much relevance recently, and I believe that it deserves much attention. Before we venture any further, let us first put the spotlight on the topic of the week, which is mental health. What exactly is mental health? Allow me to give a short summary. Mental health includes our psychological, emotional, and social well-being. It affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make choices. Being such, it basically encompasses how we live our day-to-day lives. So, it is of paramount importance that we give attention to our mental wellness. There is a very intricate relationship between mental health and sleep. This relationship may be likened to the dilemma brought about by the question, which came first, the chicken or the egg? Is sleep a symptom or part of a psychiatric disorder, or does it lead to a psychiatric disorder? More recent studies now support the theory that the relationship is bidirectional. They both affect each other, and one can lead to the other. An explanation for this phenomenon is the common underlying pathophysiologic mechanisms for sleep and mood regulation. So to further dissect this complex relationship, let us first focus on how sleep affects our mental health. It may be ideal at this point to use an approach we psychiatrists usually employ in dealing with complex situations, the biopsychosocial model. This approach looks into the interconnection between biology, psychology, and socio-environmental factors, and examine how these aspects affect the overall outcome. Sleep is a rather complex process. Upon falling asleep, thousands of neurons in the brain switch from waking to sleeping state, sending signals throughout the body. Several structures within the brain are involved with sleep. Sleep requires the concerted effort and balance of neurotransmitters acting on specific brain structures at a specific time. Speaking of neurotransmitters, this is a table of the neurotransmitters involved. There are those that keep us awake and those that promote sleep. These neurotransmitters may be familiar, as we know these are the same neurotransmitters that are involved in the neurobiology of the psychiatric disorders. Sleep is necessary for emotional health. During sleep, brain activity increases in areas that regulate emotion, thereby promoting healthy brain function and emotional stability. One example of how sleep can regulate emotion occurs in the amygdala. This part of the brain is located in the temporal lobe. It is in charge of the fear response. It is what controls your reaction when you face a perceived threat, like a stressful situation. When you get enough sleep, the amygdala can respond in a more adaptive way. But if you're sleep deprived, the amygdala is more likely to overreact. During sleep, the brain works to evaluate and remember thoughts and memories. And it appears that the lack of sleep is especially harmful to the consolidation of positive emotional content. This can influence mood, emotional reactivity, and is tied to mental health disorders and their severity, including the risk of suicidal ideations or behaviors. Humans are social beings, and sleep affects this facet of our lives as well. In a study conducted, it was found that the brain reacts repulsively to images of sleep-deprived people. As a result, there is tendency to avoid such, leading to social isolation. Sleep loss also blunts activity in the brain regions that normally encourages social engagement. Sleep deprivation also leads to less empathy, poor communication, resulting to family, marital, and relational stress. So now let's go to the next point. How does mental health affect sleep? We have seen how sleep, which is a normal bodily process, can be complicated by a lot of factors and thus require a careful balance. Now we go into when imbalance happens, when sleep becomes disrupted. Insomnia is defined as persistent sleep difficulty despite adequate sleep opportunity. It occurs at least 3 nights per week and is associated with daytime dysfunction. Insomnia is actually the most common sleep disorder, but unfortunately not the most commonly addressed. As an overview, these are the common groups of psychiatric disorders that may manifest with insomnia. We have anxiety, mood, trauma and stress-related, psychosis, substance use disorders, or addiction. So let's briefly discuss each. Anxiety is a normal reaction, but it becomes pathological or considered a disorder when there is excessive fear or anxiety that is out of proportion to the situation and is age inappropriate. It causes functional impairment because the individual cannot anymore attend to the activities of daily living. Anxiety disorders include the following: panic disorder, when there are recurrent panic attacks occurring for more than a month. Generalized anxiety disorder is diagnosed when there is persistent and excessive worry for at least 6 months. Agoraphobia is fear of being in open, unfamiliar places or situations that may trigger a panic attack. Specific phobias elicit excessive fear of a specific object or situation. Social anxiety disorder, on the other hand, is a fear of embarrassment that may occur in social situations. The following disorders also manifest with anxiety and sleep disturbances. Somatic symptom disorder is previously termed hypochondriasis, which involves preoccupation with fears of having a serious disease based on misinterpretation of bodily symptoms, while illness anxiety disorder is fear of being sick or developing a disease. Anxiety manifests with changes in sleep, such that a person finds it difficult to initiate and maintain sleep, with a decrease in the total sleep time. These changes, as studies showed, may increase also the risk of developing a psychiatric illness. Next, we have the mood or the affective disorders. Mood disorders primarily affects a person's emotional state. These disorders cause a person to experience prolonged periods of extreme happiness, extreme sadness, or both. It is normal for someone's mood to change depending on the situation. However, with the mood disorders, symptoms must be present for several weeks or longer. They can cause changes in your behavior and can affect your ability to deal with routine activities such as school or work. Depression is a global public health concern afflicting more than 300 million people. It is a serious illness that negatively affects how you feel, the way you think, and how you act. Symptoms include low mood, loss of interest, sleep and appetite changes, restlessness, guilt feelings, poor concentration, and thoughts on death and dying. Depression may manifest with sleep changes, either insomnia or hypersomnia. Patients may sleep for prolonged periods of time, but despite the extended sleep period, the sleep quality is poor, oftentimes with nightmares. And when they do wake up, they still feel sleepy and tired. Sleep disturbances actually increases the risk of suicidal ideation, suicide attempts, and even completed suicide. There is lower treatment response and lower remission rates. Residual insomnia also appears to be associated with an increased risk of relapse, as well as a number of impairments, including decreased concentration, sleepiness, and diminished performance capacity. All of these would of course mean a poor quality of life. Another mood disorder is the bipolar disorder. It manifests with changes in a person's mood, energy, and ability to function. Patients have extreme and intense emotional states that occur at distinct times called mood episodes. These episodes are categorized as depressive, manic, or hypomanic. Manic symptoms include grandiosity, less need for sleep, hyperproductive speech, distractibility, increased activity, and risky behaviors with racing thoughts. As mentioned, sleep changes in depression may be insomnia or hypersomnia. The difference with mania is that there is a decreased need for sleep. The issue is not they are unable to sleep, but they do not see the need for it. Brought about by their manic state, these patients feel that sleep is just a waste of time, as they have so much more that they have to do. It has been hypothesized that the sleep loss plays an etiologic role in the development of mania, such that the loss of sleep predisposes towards mania, which in turn leads to further sleep loss and a positive feedback cycle. Sleep disruption may also be seen with trauma and stressor-related disorders. These disorders are serious psychological reactions that develop in some individuals following exposure to a traumatic or stressful event. The two more common disorders under this classification are the adjustment and post-traumatic stress disorder. Both may be reactions to stressors. Adjustment disorder manifests as severe or intense emotional or behavioral symptoms than expected. PTSD involves the exposure to a traumatic event accompanied by intrusion symptoms like flashbacks and avoidance symptoms, with negative mood, alterations in cognition like dissociative symptoms, changes in arousal and reactivity, usually involving sleep disruption. Sleep disturbance may manifest as insomnia with decreased total sleep time and increase in REM sleep density. REM is the stage of sleep where dreams usually occur. Several studies concluded that improving sleep in patients with PTSD can improve daytime symptoms as well. So it is of paramount importance that we address this symptom as well. Next, we go to another disorder, the psychotic disorders. So first, what is psychosis? Psychosis is a condition that affects the way your brain processes information. It is defined as the loss of contact with reality. A different or separate world is created in a person's mind filled with delusions, which are firmly held fixed false beliefs that conflict with reality, and or hallucinations, which are perceptions in the absence of external stimuli. Hallucinations are usually auditory, but visual and tactile hallucinations may also occur. Ruled by delusions and at times commanded by hallucinations, psychotic patients usually manifest with inappropriate, aggressive, or even assaultive behavior. Psychosis may also manifest in patients with anxiety or mood disorders. Psychotic patients usually manifest with insomnia with poor sleep quality. There may be shifts in circadian rhythm which are reflected in the tendency to be awake at night and asleep during the day. Alcohol, nicotine, illicit substance use, or even antipsychotic medications might play a role in the shift. There is also an increase in the prevalence of sleep disordered breathing and periodic limb movements of sleep. Sleep disturbance may be the first symptom of psychotic decompensation. It adversely affects the symptom severity and the course. There is also a greater likelihood of suicidal ideation with sleep disturbances. Another one on the list are the substance use disorders, or what we term addictive disorders previously. These disorders involve the persistent use of substances despite substantial harm and adverse consequences. The list of illicit substances is lengthy, but these are some of the most commonly encountered. Criteria for the substance use disorders include dependence, tolerance, or needing increasing doses to induce the same effect, wanting to cut down or stop but unable to, cravings or urges to use the substance, drug-seeking behavior, functional impairment, spending more time using the substance while giving up on other important activities. Patients are also unconcerned about consequences like physical, medical, or even legal. So how does alcohol affect sleep? Alcohol causes disrupted sleep. Although it may hasten sleep onset, it actually suppresses REM sleep, with a rebound of wakefulness or a stimulant effect as it is metabolized by the liver. There is also disruption of the usual circadian sleep-wake rhythm. A cycle may also ensue whereby the sleep difficulties increase the risk for alcoholism and alcohol further aggravate the sleep difficulty. With that, we have just seen the bidirectional relationship between sleep and mental health, and hopefully increased our mental awareness at this point. Since we are already on the topic, I would like to touch on briefly about the circadian rhythm and mental health. With recent advancements in science, there is much interest in tying together the circadian rhythm and the other psychiatric disorders. Circadian genes and patterns are now being investigated in the hope of utilizing these as either diagnostic or prognostic tool for the psychiatric disorders. This is indeed very interesting and exciting, especially to us psychiatrists, since we do not have the benefit of any objective measure at present. Several published journals identified and related several factors to the mood disorders or schizophrenia. There were reports of possible relationship with the circadian misalignment or disruption, melatonin level and timing of release, impaired ability to respond to light, and cortisol and norepinephrine release. Although the results of these studies are inconclusive, at this point, there is sufficient evidence of the circadian contribution. So until the still elusive connection is discovered, it may suffice to say for now that the disrupted circadian clocks may make individuals more susceptible to the development of psychiatric disorders, and at the same time, psychiatric disorders also affect the circadian rhythm. So, of course, it's not enough to just identify and diagnose each psychiatric disorder and identify the sleep disturbance that it may cause. It is but prudent to also discuss, although briefly, the management. So we have to treat the underlying psychiatric condition, address the other sleep disorders that may adversely affect sleep, make medication adjustments if warranted, and most importantly, impose good sleep hygiene practices. Achieving good sleep entails setting up the stage through good sleep hygiene practices and conditioning the mind and body for sleep. Good sleep hygiene entails the following. Maintain a regular sleep schedule. Taking control of your daily sleep schedule is a powerful step toward getting better sleep. Sleep consistency is key. Set a wake-up time and stick to it. Keep naps short as they may interfere with the sleep drive. Exercise for good sleep. The health benefits of exercise is a well-known fact. The more energy used, the more the body has to recharge. Activity increases your sleep drive. But do take caution of the timing of exercise in relation to sleep. Do not exercise close to bedtime to give the body time to unwind. Eat right to sleep tight. A healthy and balanced diet is good for the body and for sleep. Certain dietary sources like cheese, milk, nuts, and grains contain melatonin, which can promote sleep. Now we go to the things we should avoid. Avoid bright light exposure at bedtime. For night shift workers, it is advisable to wear shades when you go out of your workplace all the way to your house. Darkness enhances melatonin production, thereby modulating sleep. This will signal the brain that it is nearing the time for sleep. Try drawing the shades or sleeping with an eye mask on if your bedroom tends to be bright during the day. Avoid alcohol, caffeine, and nicotine at bedtime. Caffeine and nicotine are stimulants. Alcohol, being a depressant, may initiate sleep, but the process of breaking it down has a stimulant effect. As the liver metabolizes alcohol, the individual is more likely to experience sleep disturbances and decreases in sleep quality. Thus, this is really not recommended. Now we go to the main stage, the bedroom. It is ideal to keep the bedroom quiet, dark, and comfortable to promote good quality sleep. Reserve the bedroom for sleep and sex. Do not bring work to the bedroom. Turn off all electronic gadgets as they may be stimulating. Be mindful of blue light emitted by gadgets as they may interfere with melatonin production. Allow at least 1 hour to unwind before bedtime. Just like how our computers need time to shut down, so does our body. Remove clocks in the bedroom. Clock watching may increase sleep anxiety and frustration, which in turn will keep you awake. We have to remember that the perfect night's sleep starts long before you go into bed. Here is like a roadmap to good quality sleep. The stage is set, so now let us work on conditioning our mind and body for sleep. Relaxing the mind and body promotes sleep. Relaxation-based interventions include mindfulness meditation, yoga, tai chi, progressive muscle relaxation, deep breathing exercises. These exercises aim to decrease somatic and mental arousal, thereby inducing sleep. The following are some points to remember. Keep realistic expectations. As we have discussed, several factors affect sleep, so do expect some variability. The body is not like a machine that you can just turn off to sleep at exactly the same time each day. Although sleep is vital, do not give too much importance to sleep. Obsessing on sleep would be counterproductive because the more you focus on controlling it, the more you can. Do not blame poor sleep for all daytime impairments. Attributing just about any bodily symptom to not getting enough sleep will just increase the stress and frustration. And we all know where that would lead to. Develop some tolerance to the effects of poor sleep. Not stressing over sleep leads to good results. Do not catastrophize after an episode of poor sleep. It is not the end of the world. If you're not able to sleep last night, you will actually have a higher chance of sleeping the following night because of the increase in sleep drive. Never try to sleep. It is likely to exacerbate sleep difficulties. The more you try, the more you can. Sleep is elusive that way. So if you can't sleep at night, get out of bed and return only when sleepy again. It is better to schedule brief times during the day to stress, reflect upon the situation, and try to resolve whatever it is that you can. This may help minimize the risk of being awake all night worrying. With the goal of eliminating performance anxiety, paradoxical intention may be done with the instruction to remain passively awake and avoid any effort to fall asleep. To sum up this afternoon's discussion, we saw just how sleep and mental health are closely intertwined. So please do remember that mental health is just as important as physical health. Thank you for your kind attention. These are my references.
For giving us an insight on the effects of sleep or lack thereof on our mental health. Before we proceed to our open forum, we will be having a 10-minute break. Kindly input your questions on the Q&A box, and our speakers will be addressing these questions during the open forum. Now, we will be hearing from our pharmaceutical sponsors for the day: Conjugate Corporation, Distribution Solutions Philippines Incorporated, and Johnson's & Johnson's Philippines. We would also like to thank Picar for graciously providing the residents accommodation for today's postgraduate course.
Schizophrenia and bipolar disorder are two of the most Schizophrenia and bipolar disorder are two of the most commonly occurring psychiatric disorders. More than 130 million people worldwide are affected. The dopamine hypothesis of schizophrenia states that positive symptoms arise from excess dopaminergic activity in the limbic system and striatum. The inhibition of dopaminergic activity by quetiapine seroquel is thought to be a major mechanism by which this agent improves both the positive symptoms of schizophrenia and the mania associated with bipolar disorder. Quetiapine seroquel has high affinity for the serotonin 5-HT2A receptor. Quetiapine seroquel and its metabolite norquetiapine also interact with 5-HT1A and 5-HT2C receptor subtypes. The major active metabolite of quetiapine seroquel is known as norquetiapine or N-desylketotiapine. Inhibition of NET by norquetiapine is expected to increase the concentration of norepinephrine in the synapse and therefore facilitate noradrenergic neurotransmissions in regions of the brain expressing NET, example, prefrontal cortex. This distinguishes quetiapine seroquel from most other atypical antipsychotics. Quetiapine seroquel is a partial agonist at 5-HT1A receptors. Some antipsychotics are associated with a distressing group of adverse effects known as extrapyramidal symptoms or EPS. EPS comprise a group of movement disorders including Parkinsonism, akathisia, dystonia, tardive dyskinesia. Prolactin is a peptide hormone secreted by the anterior pituitary gland. It has a range of actions including regulation of lactation. Dopamine inhibits the secretion of prolactin by binding to D2 receptors in the anterior pituitary. Some antipsychotic agents cause elevations in serum prolactin levels or hyperprolactinemia, presumably as a result of dopamine receptor blockade in the anterior pituitary gland. The loose receptor binding of quetiapine seroquel allows dopamine to displace quetiapine seroquel from the receptor and maintain its function in motor and hormonal systems, therefore leading to low rates of EPS and prolactin elevation. Quetiapine seroquel reduces dopaminergic neurotransmission by antagonizing the D2 receptor in regions of the brain such as the limbic system. Its moderate binding to this receptor may explain the reduced incidence of distressing side effects such as EPS and prolactin elevation. Quetiapine seroquel modulates serotonergic neurotransmission through its action at 5-HT2A receptors. Quetiapine seroquel, via its principal active metabolite norquetiapine, enhances noradrenergic neurotransmission by inhibiting NET. Schizophrenia and bipolar disorder are two of the most commonly occurring psychiatric disorders. More than 130 million people worldwide are affected. The dopamine hypothesis of schizophrenia states that positive symptoms arise from excess dopaminergic activity in the limbic system and striatum. The inhibition of dopaminergic activity by quetiapine seroquel is thought to be a major mechanism by which this agent improves both the positive symptoms of schizophrenia and the mania associated with bipolar disorder. Quetiapine seroquel has high affinity for the serotonin 5-HT2A receptor. Quetiapine seroquel and its metabolite, norquetiapine, also interact with 5-HT1A and 5-HT2C receptor subtypes. The major active metabolite of quetiapine seroquel is known as norquetiapine or N-desylketotiapine. Inhibition of NET by norquetiapine is expected to increase the concentration of norepinephrine in the synapse and therefore facilitate noradrenergic neurotransmissions in regions of the brain expressing NET, example, prefrontal cortex. This distinguishes quetiapine seroquel from most other atypical antipsychotics. Quetiapine seroquel is a partial agonist at 5-HT1A receptors. Some antipsychotics are associated with a distressing group of adverse effects known as extrapyramidal symptoms or EPS. EPS comprise a group of movement disorders including Parkinsonism, akathisia, dystonia, tardive dyskinesia. Prolactin is a peptide hormone secreted by the anterior pituitary gland. It has a range of actions including regulation of lactation. Dopamine inhibits the secretion of prolactin by binding to D2 receptors in the anterior pituitary. Some antipsychotic agents cause elevations in serum prolactin levels or hyperprolactinemia, presumably as a result of dopamine receptor blockade in the anterior pituitary gland. The loose receptor binding of quetiapine seroquel allows dopamine to displace quetiapine seroquel from the receptor and maintain its function in motor and hormonal systems, therefore leading to low rates of EPS and prolactin elevation. Quetiapine seroquel reduces dopaminergic neurotransmission by antagonizing the D2 receptor in regions of the brain such as the limbic system. Its moderate binding to this receptor may explain the reduced incidence of distressing side effects such as EPS and prolactin elevation. Quetiapine seroquel modulates serotonergic neurotransmission through its action at 5-HT2A receptors. Quetiapine seroquel, via its principal active metabolite norquetiapine, enhances noradrenergic neurotransmission by inhibiting NET.
Thank you once again to
Schizophrenia
our
and
major
bipolar-
sponsors for the day, Conjugate Corporation, Distribution Solutions Philippines Incorporated, and Johnson & Johnson's Philippines. We would also like to thank Multicare for graciously providing our accommodation for this postgraduate course. So, good morning, doctors. Before we proceed to the open forum, may we gently remind everyone to answer our evaluation form for this event. You will be seeing a pop-up on your screen. Just click the link and it will lead you to the form. We will be sending the prompt again later after our open forum. So, we can start the open forum. No, good morning, doctors, Dr. Picar and Dr. Roque.
Morning.
Good morning po, Doctor. Ayan po.
Good morning.
Good morning din po, Doctor. So we have a few questions naman from our audiences that we have collated. No, one of the prominent questions here is, I think this is the good for you too po. No, there is one of our anonymous audience was saying that they notice an emergence of over-the-counter sleep aid drugs like Sleepasil and Sleepwell. They would want to know your opinion on this over-the-counter medications and their benefits, if there are.
I'll let Rose answer that question first.
Okay.
Okay po,
Sige po.
Doctor. Yes,
Beauty
exactly.
before age.
Opo, so inangkin ko na, Doktor, sabi ko, opo lang. So, this is really a concern and we see this a lot kasi there is an increase in the number of mga over-the-counter. Siguro we just have to be a bit cautious on this. So what I discussed earlier, it's better really to know first what's causing, if there's a sleep disturbance, if there's insomnia, to know exactly what's causing it and to address that. We have to remember kasi, just as Dr. discussed earlier, and I touched a bit on that, that melatonin, usually this is the content of these sleep pills, sleep aids, sleep well, and all of those under over-the-counter drugs. So melatonin, we have that in our body already. We have that in our system, and it actually is the one that's putting us to sleep. So it's like parang a supplement. The thing about melatonin is it can actually shift your circadian rhythm. So a bit caution on that. And of course, if we do not identify and properly address the cause, if it's anxiety, I see that a lot recently, depression, or other, actually even the poor sleep hygiene. If we don't address that, it would be rather frustrating. And I encounter a lot of patients saying, Doctor, I've tried all the other medications and it's not working. Well, in fact, unfortunately, it's not expected to work if we're not addressing. I mean, if it's really anxiety that we're dealing with, medyo no effect the melatonin on that. And that would increase it further because you have there in your mind, there's very severe naman to what I'm experiencing. I've tried everything already. So there, siguro, caution on that also. But we have that already. So do trust your body also. As Doctora discussed, we have several systems, several processes at play. So we just have to sync our schedules also and align with our body clocks.
I'll just like to add that first of all, you need to know what you're treating for you to know which medication you should take. Second, if the sleep problem is really causing a significant dysfunction, that means it's affecting the way you work, the way you, your quality of life, then you need to see a doctor. Marami kasing sleeping aids na pwedeng gamitin, diba? So aside from melatonin containing compounds, there are people who use diphenhydramine, for example, antihistamines, which will also have side effects. No? So it's very important to know what you're treating. So melatonin, for example, is something that is really very useful for circadian rhythm correction. So when you have a problem with circadian rhythm, so like you're sleeping too early or you're sleeping too late, or you're dealing with jet lag, or if you have a shift work sleep disorder, then it can be utilized for these conditions. But it's always best to use it with the guidance of a physician. Because we will have to teach you how to address that and how to figure out whether you fit that specific particular population that will really benefit from these medications. No? So I think the important thing is wag na kayo magmarunong-runungan pa. Wag mo na kayo makinig sa mga marites, mga pakailamera, nakapitbahay, seek professional help, especially those people who really know how to deal with these kinds of conditions so that you can actually get the most out of your treatment. Yeah.
So I think that sums up the answer for that question. And it's a good thing that we have to know when we will need the help of a professional before doing anything rash or unwarranted. So before we take medications, might as well have a consult first. Kasi that's how they will gauge what you need and what is the best for you. So if ever we continue with the open forum, we have another question from Janine Giselke. She from her question po, thank you for both your presentations today, Dr. Picar and Dr. Roque. She has been seeing many night shift call center agents coming in for increased anxiety and depressive symptoms correlated with poor sleep. Besides the recommendation given today, do you have any other recommendations that can be given to them? Or would you instead have recommendations for structural change for the institutions employing for the schedules? Kasi, it's a big change, diba? That if we are to impose that. May I know your answers po, doctors?
Okay, I think that's an excellent question and it's an excellent proposition in terms of solutions. So there are several ways by which you can address shift work disorder. One is, yes, institutional. That means that if the BPO industry would actually just reach out to us, no? And talk to us about what would be the best for their workers, we will be more than happy to work with them. For the institution, kung halimbawa, merong isa rito na may-ari ng BPO company, malay mo, di ba? Maybe we can reach out to them. The basic rule is this. If you are in a shift, the most important is the direction of the shift. So that means the most important is that it should be clockwise. So sabihin, kung morning ka ngayon, mid-shift ka susunod, tapos night shift ka susunod. Mahirap po kasing pabaliktad. Okay? Because it's always easier to sleep later and wake up later than to sleep earlier and to wake up earlier. And you know that when you have Mondays, diba? So it's always easier to do that. Second is that yung speed by which they change their shifts. Recently, what they're finding out is that it's actually better to be on a shift for a longer period of time. So sabihin, yung rapid shift changes actually is more difficult to cope with. So sometimes it's easier to be on a certain shift, like for example, for a minimum of 2 weeks. No, kasi you need around a week to face shift, to change your shift, yung sleeping time mo to change it. It takes around a week. And that is dependent also on your age. So if you're an older BPO worker, it takes longer for you to change your shift, unlike if you're younger. Now, the other one is yung how do you manage, so yun yung structural or institutional, okay? The other one is more individual. I think the individual mas madaling i-address, okay? What can the shift worker do to make sure that he sleeps well when he's getting off of shift? Kasi yun ang dalawang issue mo eh. Paano ka makatulog when you're off the shift? And how do you stay awake when you're on the shift? Because you're fighting against your own circadian rhythm, diba? So, the first thing is, sabi ko nga, light is very important for circadian entrainment. So, during the time that you're supposed to be sleeping, then there has to be complete absence of light. So, yung sleep environment mo has to be cool, dark, and quiet. Even the commute, no? Bawa, pauwi ka na sa bahay mo from the BPO center, then what you need to do is also minimize your light exposure even on the commute home. So, kailangan magsuot ka ng dark glasses and we call them bandit glasses kasi hanggang dito siya. Para talagang madilim. Okay? And wag kang mag-shopping, wag kang mamili, wag kang mag-supermarket before you go to sleep. You go to sleep first. Then afterwards, you can do your other chores when you're more or less awake. Now, the other, yung isa pa is you need to have yung sleeping time mo as much as possible should be similar to your sleeping on your duty hours or your working hours, working days, and your off days. Nagkakaproblema ang shift worker kapag, bawa, night shift siya during the Monday to Friday. Tapos pag weekend, ang gagawin niya, ibabalik niya sa dati yung kanyang rhythm. That's when you get into trouble. As much as possible, you want to stay within the time frame at which you sleep 7 days a week. Huwag ka masyadong mag-deviate. If you can deviate to only as much as 1 to 2 hours. Not more than that, kasi mahihirapan ka. Sabi ko nga, it takes a week. No? Kasi kung gagawin mo yan na every weekend, mag-iiba yung time frame mo, by the time na nag-a-adjust ka during the work week, iibahin mo na naman siya. Kaya magkakaproblema. Okay? So, also, basic yung common sense. So, do not drink alcohol to induce sleep. Stay away from nicotine or smoking. Control your caffeine. So, the caffeine should be at the start of the shift, not at the second half of the shift, because it will impact your sleep once you're off of shift. Yun yung mga very basic and very common sense actually. But there really are some people who are not made for shift work. Okay? You need to understand that about yourself. May mga ibang tao talaga na hirap mag-adjust. If you're one of those, then this might be the line of work that is not for you. Go to another job na may regular yung sleeping and working time. May mga ibang tao talaga na kayang-kaya nilang mag-adjust. Well and good. But it's a career that should be short, okay? Wag niyo siyang isipin na this is my career for 50 years. Hindi. You have to consider that this kind of a job should only be done for a given period of time. Because what they have seen in long-term studies is that yung mga shift workers who stay in shift work for a longer period of time are exposed to diseases. So it is even has been proposed as a possible carcinogen. Okay? So by the World Health Organization. So sabihin, mas malaki yung nakikita sa mga tao who are in shift work in terms of having more cancers, malignancies, as well as other cardiovascular diseases, which we already talked about in my lecture earlier on. Mahaba yung sagot ko ha, kasi yung shift work, isang lecture yan eh, okay? Kaya po talaga sagutin ng mabilisan, okay? So, if you want to know more about it, and I think that the one who asked the question is a physician, then I strongly recommend that you attend our annual convention sa Philippine Society of Sleep Medicine, because we always talk about these things so that you'll have a more in-depth understanding. Diba? Diba, Rose? O yan ha.
Promoting na, Doctor.
Promo
Yes.
pa ako, okay? Kasi po mahaba masyado, mahirap sagutin ng ilang minuto lang. Okay. Yes, Lay. Next question.
Sorry, Doctor. Dr. Roque, anything to add pa po?
Ay,
With
yun.
regards
Kasi,
to-
oo nga,
yan.
basically yun nga yun kasi it's very long. Correct si Doktora. Kasi it's a whole topic din siya.
Module.
Yes, whole chapter or more. And it's very relevant actually kasi we see a lot of shift workers also. And that's the reality. We are living in a 24-hour na world right now. Before we were limited because we didn't have artificial light or so. But now kasi we are really 24 hours talaga. So kaya medyo nakakaroon ng concern with I mean, that's good. We're progressing. Siguro lang nga din the adjustments that we have to understand how the body works and how we can sync it. Kasi ano din siya, I know, dun sa psychological part, I know this is the stress that it would cause. That's stressful, but it is also stressful if we don't have a job. So I mean, we balance that off also.
Which is true nga po, Doctor. Talagang we need to find the balance with regards to how we are pushing our boundaries as humans. Siyempre, sleep is a very essential part of living, so we don't want naman to mess things up just to sacrifice it for progress or anything. So that's there are many factors regarding dyan sa shift work problems, especially with the sleep and with the internationalized and globalized economy. It affects all of us one way or another. So if okay with you, no, doctors, we have another question. No, do hours of sleep include napping? From Miss Ida Shason. Do hours of sleep include napping? There is a belief that daily napping increases lifespan due to its protective relations to heart disease. Any comments on this?
Okay. First of all, if you are sleeping enough, generally you don't need to take a nap. Okay, so that's actually an indication for you. If you're getting the right number of hours of sleep that you require, that your body requires, and you're taking it at the right time, there is really usually no need for you to take a nap. So that's actually an indication, especially kung bata ka, no, and you're getting enough sleep, and then you're still sleepy, and you end up taking a nap. Then you need to take notice of that, because bakit? Because it means that there might be something that's disturbing your sleep at night, like sleep disorders such as sleep apnea, restless leg syndrome, that's disrupting your sleep. So you're not getting good quality sleep, and that's why you need to take a nap. Now, ayaw kasi naming magkaroon ng misperception, no, na if I sleep for 4 hours a night, it's okay. As long as I take a nap, I'm good. No, that is not correct. Okay, it's not correct. It is best to get your good dose of sleep at night. Okay? Dapat po ganon. Kasi sabi ko nga, duration, timing, and efficiency. Hindi po pwedeng isa lang. Okay? Hindi rin po pwedeng tingi-tingi, no? Na para tayong naguhulog sa buhay, no? Ang ginagawa, ay,
Installment.
matutulog ako ng 2 hours ngayong umaga, tutulog ako yun ng 4, makaka-anim din ako, okay? Sabi ko nga, tatlo ho talaga yung components na kailangang iisipin nyo lagi. That's why it's really best to have that sleeping period at night. Ngayon, there are certain situations wherein you will really need to take a nap. For example, in older individuals, pag tumatanda po kasi, because nagde-degenerate, no, yung pinag-usapan nating brain structures that control sleeping and wakefulness, nagkakaroon ng degeneration yan. So sometimes, older individuals will really end up having more fragmented sleep, and they also have shorter sleep periods at night. That's the only exception. Sometimes they will really need to take a nap so that they can recover a little bit. Okay? But for older lang yon. So, kung di pa kayo matanda, wala pa kayong karapatan na mag-nap na ganyan. Ngayon, the other end of the spectrum, yung mga bata, okay, sabi ko nga, the younger the organism, the more the requirement for sleep. Ngayon, hindi naman po pwede kasi, bawa yung infant sa 16 hours, hindi mo siya pwede matulog ng 16 hours tuloy-tuloy, no? So what will happen is that they will really have a big block of sleep at night, and then they will have naps during the day. That is normal. Okay, so for younger individuals and older individuals, then the naps will be an important thing. Pero yun pong majority of individuals, mostly in the adult group, no? Usually po, you shouldn't need to take a nap. Now, I also emphasize this to my patients, no? Taking a nap, the length of it, and the timing at which you take it is also important. Kasi may mga iba who take a nap like at 4 or 5 in the afternoon. You need to remember this para madaling matandaan. Everything should be in 8-hour shifts in a way. So like if you sleep at 10 p.m., you wake up at 6, the usual time na aantukin kayo is between 1 to 2 in the afternoon. That's 8 hours after. After 8 hours, that's the usual sleeping time, 10 p.m. Ngayon, pag ginawa nyo na nag-nap kayo ng 4 to 5 in the afternoon, if you count 8 hours from there, what you will notice is that yung sleeping time nyo mag-move din po siya. Okay? That is why it's very important when you're dealing with people with circadian sleep problems or insomnia, no? Kailangan maintindihan nila yung impact of the nap at the time that they take it and also the length at which they take it. So the best time to take a nap is 8 hours after waking up, and the duration should be not more than 20 to 30 minutes. Okay? Para po hindi siya gumulo sa timing ng tulog nyo. Okay? Tsaka pag nangyari yan na mahaba yung tulog nyo sa hapon, hindi enough yung sleep depth, or shall we say, sleep propensity nyo sa gabi. Kaya ang mangyayari niyan, iikli yung oras ng tulog nyo sa gabi. Okay? So meron complications lahat yan. I hope I answered that question properly. Maybe Rose can add something.
Yung with regards, correct, doctor, kasi we see a lot of that also. They try to make up for lost sleep. Na parang yun yung nagkikita natin, parang like perpetuating, actually aggravating the insomnia. The common, unfortunately, notion that if I wasn't able to sleep last night, kailangan ko bumawi, kailangan kong matulog. All the more actually that it would aggravate it. Kasi what Dr. said nga, we have to always, I always tell my patients, we're like cell phone, a gadget. If you charge it several times during the day, you wouldn't need to charge it again at night. And then the anxiety, the stress increases. Bakit hindi na naman ako makatulog? And then you end up, babawi na naman ako tomorrow. And then namumove. Tama po yung circadian kasi yung sleep drive, yung antok natin. Walang nawawala yung antok din, yung need for the sleep. Kasi nga, several times during the day, binababa natin ang binababa when we nap. So we have to be cautious of that. Kaya in general, that's what we advise. Kasi lagi din nilang sasabihin, hindi nga po ako nakakatulog kahit araw, kahit during the day. And we say, ay, very good po. Wag na po kayong matulog. I-reserve na po natin sa gabi. So that's the main reason for that also. So inaano natin, sinisync, gusto natin mag-sync yung sleep drive and the circadian rhythm. And that's the way para din siya mag-align.
Thank you po, doctors, for the answer. No, we really need to understand properly the balance of the circular, proper balance, and the tenets that that our consultants and our lecturers have given us today to properly understand how we can manage sleep. And if we are having problems, no, it would always be better to consult a professional after after doing what you want, but not self-medicating. We don't want that. One of the things that another question here is actually I think I have an inkling of the answer, but I would want to also forward this to you, Dr. Spono. What do you what is your take about people taking energy drinks just to prolong yung sleep nila? I know it really disturbs the sleep pattern, the rhythm, but they are compelled to do so just to increase their productivity. How do you think this will affect them in the long term?
Roque, you want to take this one? Yeah.
Kasi siguro we have to understand first why is there a need for the energy drink. Kasi we have encountered it several times over there. Kasi usually yung ibang patients would take energy drinks because I feel very sleepy during the day despite getting enough sleep at night. And we look, of course, at the usual cause of this kasi is the not getting good quality sleep. So usually then yung mga apnea, those with apnea, kasi sleep disordered breathing, it disrupts the sleep. So we have to understand then kung bakit may need for that. Kasi this is one of the primary cause and we have to address it as well. People would say, I slept like 8 to 10 hours or even more, pero I feel very sleepy pa din during the day. Hence, I need to take the energy drinks. So energy drinks, and then we have to take note, again, the timing, as Dr. was saying. Kasi nga, na parang we have to understand, yun nga, pag parang medyo ina-up mo, stimulants kasi sila. So, if nandun ka dun sa level na yun, tas nearing your bedtime, of course, it would affect sleep. So, there, and ano pa kaya, kasi ang naisip ko lang din with the energy drinks, yun nga, bakit may need for that? So baka meron kasing nakaka-affect nung nighttime sleep, kaya there is a need for them to take something. So definitely, we have to address that as well. And then, yun. Sometimes I encounter then some people na because they are taking other medications na medyo siguro not hiyang for them. So they end up, I encountered one case na so she's taking medications na actually parang na-recommend lang sa kanya. And what this does is actually put her to sleep very much na hanggang nag-spill over during the morning. Tapos she has to take energy drinks para to counter the effect. So baka kaya kailangan always we have to tailor fit. Kasi each individual is different and I know madami kasi na this worked for me, this might work for you, pero better to tailor fit it. To customize. Never too early to seek a consult.
I think the other important thing, though, with regards to these energy drinks, is that it is caffeine. Okay, it is caffeine. So it's a caffeine at a higher volume. So of course you will expect all of the expected side effects of caffeine, and so it's not just enough to talk about the volume and the reason in terms of why you need to take them, but also more important is the time at which you take them. So the timing at which you take them can impact your sleep as well. So I've seen patients na inom ng inom hanggang sa mga around 2 or 3 hours before they go to bed. And then they start to complain that I wake up very often, I go to the toilet. It's because of the effect of the medication of the energy drink. So they're not inert. No? So you need to respect how to use them. And I think generally I avoid them. I tell my patients not to take them. Kasi mahirap siya i-control yung amount of caffeine that they're taking. Okay? Yes.
Kasi with
Ano pa,
different
Lay?
Sige po, Dr. Roque.
Dami mong
Ay,
tanong
ganyan.
Lay. Ano ka?
Ang dami nga po. Sige,
Sorry,
Dami
Doc.
nito.
I think
Oh,
that's
bilisan
the
natin.
that's the ano naman na doctor, that's the last of the questions na po for the medyo limited din yung time natin. We have to end kasi rin by 12 o'clock. So I think we have with the questions that we have discussed, we have circled around the topic of sleep, and we have emphasized naman the need for balance and the main tenets that we need to remember when we are dealing with sleep. We also emphasize the importance of having a consult before we try anything that is unwarranted. So thank you, Dr. Picar and Dr. Roque, for that fruitful discussion. Indeed, we learned from a lot from you today. And before today ends, no, we would like to spend some time to thank our sponsors.
Thank you.
Thank you.
Thank you.
Thank you po, doctors.
Thank you to our major sponsors. Conjugate Corporation. Distrofil, Distribution Solutions Philippines Incorporated. Johnson's & Johnson's Philippines. Lundbeck Philippines. MedChoice, CNS Pharma Group. Medicam, the CNS subsidiary of Unilab. Otsuka Pharmaceuticals. Torrent Pharma Philippines. We would also like to thank our minor sponsors: Abbott Laboratories, Sun Pharma Philippines, Zydus Neurosciences. Special thanks to Vexa Life Sciences. This event is powered by Beatrice.
Thank you, everyone, for attending day one of our webinar series on mental health entitled Bridging Mental Health, the Pursuit of Well-Being. Please don't forget to answer our evaluation form for this event, and we hope to see you all again in the succeeding days. Reminders for the succeeding days will be sent to your respective emails. Continue to stay safe, everyone, and see you again tomorrow for day 2. Thank you.